Hello, this is Dr. Salam from Advanced Regenerative Medicine, and we are here today. We're going to actually do an injection on our patient who's given us consent to do that. We're going to do PRP, which a lot of people ask about, and we're going to talk about that a little bit, and then we're actually going to show you the actual injection on someone's knee so that you can see that it's not terrifying. It's really not uncomfortable at all. We take special steps to try to help that. First thing we do with PRP is we take your blood, so it's actually you going back into you, so there's no chance of rejection, and then we spin it. Now, the red blood cells you can see here at the bottom, they're heavier, so in the centrifuge they go down to the bottom, and up here is the plasma. So PRP is platelet rich plasma, and inside here we have all kinds of platelets, but we've also got growth factors, and we've got some special proteins that are really good for helping build cells. And we're going to draw out just this amber colored portion and put that back into Johnny's knee. So that is what the tube looks like after you've drawn the blood and you've spun it with the centrifuge. And Kelly is going to take out this amber color right here, and we're going to put that in Johnny's knee. All right, we are going to do the actual injection on Johnny. Johnny, turn around and say hello to everyone.
Hello.
This is just an opportunity to see what actually happens with an injection, to take the fear out of it for people. We talk about imaging being so important, partly for the patient's comfort, they can see what's happening, but also so that our practitioner has the ability to see where she's going with the needle, make sure we never miss, we're always in the right location, and without imaging, that's pretty impossible to do.
So my name's Kelly. I'm the nurse practitioner here at Advanced Regenerative Medicine, and I do all of the knee injections. This is our fluoroscopy machine. The first thing I do is I take a picture. This is kind of my base picture to make sure that I'm in the right anatomical area, which I am. Next, I feel for some anatomical landmarks. Gauge where my needle is going to go, and it's right about where I want to be. So I'm just using the needle cap right now to make an indentation in the skin. And then I take a second picture just to see about the depth that I should be injecting or inserting the needle. Next step is we clean the area.
We have nice relaxing jazz music up on the screen.
Okay, so this is the coolant spray that we use. This topically numbs the skin just so that the first puncture of the needle isn't as bad. Next, the first thing I inject is a little bit of lidocaine. This just helps numb the area for the needle passing through. How's your pain?
Good.
Let me know if you feel anything.
So, Johnny, tell the camera what you're feeling right now, what you're experiencing.
Right now, after the spray, it just is really cold. Right now, all I'm feeling is just a little bit of pressure. Kind of the way that I described it to Kelly is it's kind of the opposite of a blood pressure cuff. So instead of going through and compressing, it feels more like it's expanding. Outside of that, as she's wiggling the needle around, I just feel a little bit of pressure, but no pain.
Excellent.
Lovely.
Okay. So this is the actual prepared platelet rich plasma.
Just
We use the same exact needle that I just used the lidocaine with. So you only get one poke. Then we just slowly inject. Still feeling okay?
mm-hmm.
So Kelly, are you changing the angle to make sure that you get distribution across
Yeah.
all the surfaces?
So that's the other thing. I like to, the term that they use is pepper. So I inject a little bit of platelet rich plasma in kind of multiple angles just to make sure that I'm coating the entire area with those platelets. Platelets are attracted to inflammation, And obviously the inflammation is typically not in just one area. Still feeling okay?
Yep.
Good. Just pressure?
Just a lot of pressure.
Yep. Almost done.
Now Johnny's young. A lot of our patients are over the age of 65. In fact, most are. But people under the age of 65 can have knee troubles too. For instance, Johnny, how old are you? 27?
I'm 26.
26. And Johnny played hockey at a very high level, played goalie, and going down and doing butterflies and bouncing back up, much like a catcher in baseball. His knees look like someone who is 65, even though he's only 26 years old. So you don't have to be a senior with bad knees to be able to get our help, although most of the people that we do see are over the age of 65 and are trying to avoid a knee replacement. And that's certainly something that he's trying to avoid somewhere down the road too.
Absolutely. And she's already done.
And I'm done.
Done.
We do a total of 3 injections, 2 to 4 weeks apart. This is Johnny's 3rd injection, so this will be the last one of this round of Platelet Rich Plasma. And you've told me that your knees are already feeling better.
Oh yeah, I was gonna say when you said I was due for my 3rd one, I didn't even realize I had a problem anymore. So it's honestly it's pretty darn amazing. I couldn't shut up about it to everyone.
Now, Kiss, if you bring the camera down and you show where the injection site is right there, you can see that, literally there's just a tiny, where the injection was, little, we're going to put a Band-Aid there, but, it's an incredibly small, injection, and that's it. The patient walks out the door with a Band-Aid.
Boom.
And we encourage people not to go home and sit on the couch. It's important that you move around because that's part of how the material gets distributed and touches all the surfaces. So if Johnny wants to go play golf, that's fantastic. The 2 things we ask people not to do is jumping jacks or jump out of an airplane. Other than that, go shopping, go play golf, go about your life. There's literally no downtime.
Yeah.
Awesome, great job, Kelly. Fantastic as usual, and Johnny, thank you for allowing us to do this. And please make sure that you subscribe and like us and comment. Make sure you hit the bell so you can get future notifications. And from Advanced Regenerative Medicine, thanks so much.
Thank you.